Hey guys, I'm always thinking when I'm driving, so I thought I'd just start recording and talking to you guys. The biggest thing when I talk to patients is they're so confused about what is nerve damage. It's very bright today. I love it. Maybe cold, but it's bright. Actually, let's talk about this. The sun, even though it's cold outside, I don't think people understand the power of getting out and just walking, even when it's cold out, because you're still getting Mother Nature's infrared lights and vitamin D, and it's been shown to actually help your metabolism when you go out and walk. Bundle up, especially after you eat. If you go walk, you help your body actually not have so much glucose in the foods that we eat. Like, I was just learning how bad starch is. Like, it's actually worse than sugar, the way we make it in this country. And FDA has never done any research on it. They just consider it like kind of like it's just we assume it's a safe food. Like, that's crazy to me. My wife is doing this keto protocol right now, and like she's already lost 12 pounds. It feels great. Her pain in her body is gone. Her night sweats is gone. Like, her everything they would tell a woman perimenopause, like, just your age. Well, that all disappeared now that she's doing the keto diet. And really what it is when we get rid of inflammation in the body starts healing itself. And so inflammation is the problem. We blame arthritis and we blame age, but we just say these words, and I hear it all the time. Arthritis, it's just my age, arthritis. And I'm like, so your right shoulder hurts because of arthritis and age. Okay, so your right shoulder aged faster. You don't think maybe you did something to it and it's not healing? So the biggest thing is we get rid of inflammation. That helps everything. It helps my gut patients, helps my neuropathy patients, helps my knee patients, my shoulder patients, brain fog patients. Like, it's going to help the whole system because everything starts with inflammation. Like, we have over 700 autoimmune diseases that really comes from inflammation. And then there's like some subcategories under that, like why you're still living in inflammation. You know, then I look at parasites like the fungus, candida, even some viruses. It's a toxic environment. That's what I look for. Is the body toxic in any way, shape, or form? And so that's the biggest thing we worry about. Is the system toxic also? There's toxic overload the system has. And the body will not heal if it's in a toxic overload. I think that's really when you see autoimmune people, their body's gotten such a toxic overload that it's actually now going to the blood-brain barrier. That's why we should be very specific on how we heal those people to get the toxic system clean. And we have ways to do that. Then I use technologies, but so the most basic level, if you have pain somewhere and you've been trying things, it's not working, you got to try something different, because the human body is meant to heal itself. You got to figure out why is it not healing. A lot of us don't want to take responsibility, is what I've learned. Like, you've had such strong rituals and patterns you've lived your whole life that just become normal to you. Like, you eat these foods, or you drink these foods, or you just think these thoughts. You've never thought about those actually are affecting your health also. But you've just done them your whole life. So you assume, well, this problem just started, so therefore you don't equate those two coming together, but they do. There's so many patterns people have. Like, we eat out of emotions, not really out of nutrition. You have to be very conscious. Like, when I did a fast the other day from sugar, then I also did just a 3-day fast in general. Like, you just don't realize what you eat all the time until you actually do some kind of fast. Like, I didn't realize how much sugar's in everything, and how I was craving sugar at night basically just because I was bored. Like, kind of just unconsciously do it all the time. And then when I fasted, I was like, oh wow, that's a big deal. So I know a lot of patterns are like that. Because the question I get is like, how did this happen? I'm like, well, it took a long time. It's a pattern of destruction of the tissues. It's the boiling frog theory, where you don't throw a frog in boiling water. You just slowly turn up the heat. And before you know it, the frog is boiling. That's what's happening to people's bodies, and it's taken years. Even though your symptoms, you may say, I've had people tell me, well, it's only been a few months. But as I really talk to them, I'm like, it really, as we dig deeper, it hasn't been a few months. It's just you recognized that it's gotten worse in the last few months. But you've had these symptoms off and on. It's just your body wants to survive and live. And when it starts sending signals that aren't going away, it's actually more dangerous, especially with like neuropathy, because you don't really feel the symptoms, like numbness. You're not feeling. It's just a weird feeling. So if you're having weird feeling in your feet, it's a telltale sign you're not getting good blood flow and you're full of inflammation. That's what neuropathy really is your body's not getting the nutrients it needs and the cells are literally dying. And I wish people understood that about neuropathy. Your cells are literally dying, and that's where you're getting tingling, numbness, burning, weakness, balance problems, cramps in your legs. Like, these are all cells not getting what they want. Just like if I didn't feed you, your stomach would start cramping, start making noises, not feeling good, may even hurt. Or if I was like putting your head underwater and you were suffocating, not getting oxygen, you start wanting more, you start panicking. That's what your cells are doing at the most basic level with neuropathy. And everybody thinks they have just sciatica, and I'm like, well, those are totally different. Sciatica, you may have some back pain. Neuropathy is going to be in your feet and your legs more. So it's more from like back down, butt, back of your legs. That's more sciatica. And disc injuries, which we still help with. But neuropathy is where the feet, toes working its way up. That's the difference. So it's different directions. And it's much worse, actually, in my mind, than sciatica. So it happened to my dad. He thought he had just sciatica, and then he got drop foot. He couldn't lift his feet like he was supposed to, and he started tripping and having a hard time walking. But we got to it right away, so we totally reversed it. And you can do that. We can reverse neuropathy. So there is hope out there. You got to find out what kind of nerve damage you have. And the patience I never want to take is you have to do work. Like, you have to be willing to want to help yourself. That's the thing that bothers me, is like, we got such a model in this country where we just think somebody's going to do something for me or give me a pill or do a surgery. That doesn't really, we're the sickest country in the world with the most medicine, the most surgeries, the most drugs. Even when I thought about this, we take the most statins, which is for cholesterol, which is supposed to prevent high blood pressure and heart attacks, but we still are the country with the most heart attacks, the most high blood pressure, with the people on the most medications, but yet we're still the sickest country for these problems. So something's not adding up. I mean, you look at countries that move their body, eat better, don't have all the processed crap in their diets, they do better. Just, they live longer, and they don't have all the heart disease and diabetes like we do. So, and it's really what Alzheimer's, dementia is. They're finding that, like, when they tested a few people with Alzheimer's, 100% of them had mold in their brain, mycotoxins. And so it tells us that these toxins are building up in the system, and the body is not, they can't filtrate them. And so that's what we have to start thinking and looking at when somebody's sick. And that's what we look for. So hopefully this is helpful. Have a good day. See you later.